Glutathione. Used to measure the amount of glutathione in the blood. Methodology is liquid chromatography or tandem mass spectrometry. Glutathione reductase, RBC. Glutathione reductase is an enzyme. This test may be performed to evaluate riboflavin deficiency or G6PD deficiency. Method is enzymatic or spectrophotometry. Glycated protein. Blood is specimen. Method is colorimetry, nitroblue tetrazolium, NBT. Gonadotropin, follicle stimulating hormone, FSH. This test may be requested as FSH or follitropic. This test may be requested in an infertility workup. Method is immunoassay. Gonadotropin, luteinizing hormone, LH. This test may be requested as LH, lutropin, or interstitial cell stimulating hormone, ICSH. LH may be ordered as part of an infertility workup. Method is immunoassay. Growth hormone, human, HGH, somatotropin. This test may be requested as GH, HGH, or somatotropin. Amniotic fluid sample is obtained by amniocentesis, which is reported separately. Method is radioimmunoassay. Growth stimulation expressed gene 2, ST2, interleukin-1 receptor like 1. Test specimens may include serum or plasma. Test method is quantitative enzyme immunoassay. Haptoglobin, quantitative. This test may be requested as HP, HPT, hemoglobin binding protein. Method is turbidimetry or nephelometry. This procedure measures, quantifies, the amount of haptoglobin present in serum. Haptoglobin, phenotypes. This test may be requested as HP phenotype, HPT phenotype, or hemoglobin binding protein phenotype. Haptoglobin is a plasma glycoprotein. Method is turbidimetry or nephelometry. Helicobacter pylori, blood test analysis for urease activity, non-radioactive isotope, e.g., C13. The patient swallows a pill or drinks a solution containing the chemical urea, labeled with the non-radioactive isotope C13. A blood sample is taken 30 minutes after ingesting the radio-labeled urea. Analysis is done by gas isotope ratio mass spectrometry. Helicobacter pylori, breath test analysis for urease activity, non-radioactive isotope, e.g., C13. Drug administration. Helicobacter pylori, H. pylori, bacteria can now be identified using a simple breath test. The patient swallows a pill or drinks a solution containing the chemical, urea, labeled with a stable, non-radioactive isotope, C13. Breath samples are taken 6, 12, and 20 minutes after swallowing the pill. Analysis is done in a pathology laboratory using a mass spectrometer. Heavy metal, e.g., arsenic, barium, beryllium, bismuth, antimony, mercury. Qualitative, any number of analytes. Quantitative, each, not elsewhere specified. This test may be requested as a toxic metal or poisonous metal screen. Method is AAS, colorimetry, or neutron activation analysis, NA. This test measures, quantifies, the amount of each single metal present. Hemoglobin fractionation and quantitation, electrophoresis, e.g., A2, S, C, and/or F. This test may be requested as HB electrophoresis. This test uses electrophoresis to test for several hemoglobin variants. It is used to identify the different types of hemoglobin present in the blood and measure, quantify, the amounts of each. The normal types of hemoglobin are HbA1, HbA2, and HbF, fetal. Hemoglobin fractionation and quantitation, chromatography, e.g., A2, S, C, and/or F. This test may be requested as HB chromatography. This test uses chromatography to test for several hemoglobin variants. Hemoglobin, by copper sulfate method, non-automated. The copper sulfate method for measuring hemoglobin is performed by placing a drop of blood into each of a series of containers containing copper sulfate solutions of varying specific gravity. If the drop sinks, the blood has greater specific gravity than the copper sulfate solution. Hemoglobin, F, fetal, chemical. Hemoglobin, F, fetal, qualitative. These also known as HbF method for blood specimen is electrophoresis. Method for stool specimen may be by alkali denaturation visual screening. The procedure is used to examine fresh red blood taken from a fresh stool sample. Hemoglobin glycosylated, A1C. By device cleared by FDA for home use. These tests may also be known as HbA1c. A blood specimen is collected. Methods may include high-performance liquid chromatography and ion exchange chromatography or FDA-approved home monitoring device. Hemoglobin, methemoglobin, qualitative. This test is performed after the onset of symptoms to detect the presence of the derivative methemoglobin in hemoglobin. This derivative occurs when the iron in hemoglobin is changed to different state due to certain compounds introduced into the bloodstream, e.g., sulfonamides, chlorates, nitrates, nitrites, aniline. This is a qualitative test to determine the presence of methemoglobin. Method is typically CO oximetry, spectrophotometry. Hemoglobin, methemoglobin, quantitative. This test is performed after the onset of symptoms to detect and measure, quantitative, the percentage of total hemoglobin containing the derivative methemoglobin. Methods may include CO oximetry, spectrophotometry. Hemoglobin, plasma. This test evaluates hemolytic anemia, especially intravascular hemolysis. Method of testing is spectrophotometry. Hemoglobin, sulfhemoglobin, quantitative. Method is CO oximetry, spectrophotometry. Hemoglobin, thermolabel. This is also known as the unstable hemoglobin heat denaturation test. Method is by heat denaturation. Hemoglobin, unstable, screen. This test screens for unstable hemoglobin, a fall in the stable baseline of hemoglobin. Hemoglobin, urine. Method is spectrophotometry. It tests the presence of hemoglobin in the urine without the concurrent presence of red blood cells. Hemosiderin, qualitative. This test is performed to detect the presence, qualitative, of hemosiderin. Methods may include slide preparation and stain for microscopic examination. A sample from a morning collection of urine is preferable. Hexosaminidase, each assay. The test may be performed to detect the deficiency of hexosaminidase. Specimen collection is by venipuncture, If female, patient should not be pregnant. Methods may include chromatography and automated heat inactivation/fluorometry. Histamine. This test detects the presence and measures the levels of histamine. Method may be radioimmunoassay for blood or urine. Homocysteine. This test may be requested as total homocysteine, THCY. The presence of homocysteine in urine or blood may be indicative of metabolic disorders. Method is high-performance liquid chromatography, HPLC, ion exchange chromatography, or spectrophotometry. Homovinylic acid, HVA. This test is performed for the analysis of catecholamines or catecholamine metabolites. Homovinylic acid, HVA. Specimen collection is random or 24-hour urine test. Method may be high-performance liquid chromatography. Hydroxycorticosteroids, 17-OHCS. This test is used to measure the cortisol metabolites, 17-OHCS, for assessing adrenocortical function. Specimen collection is by 24-hour urine sample. A 24-hour test is necessary due to variations in cortisol metabolite excretion. Method is commonly Porter-Silber. Hydroxyindoleacetic acid, 5-HIAA. This test may be performed to measure the levels of 5-HIAA for detecting and following the clinical course of patients with carcinoid tumors. Specimen collection is urine, collected over a 24-hour period. Method is high-performance liquid chromatography. Hydroxyprogesterone, 17D. This test may also be known as 17-OHP. Methodology may involve radioimmunoassay. Hydroxyprogesterone, 17D. This test may also be known as 17-OHP. Methodology may involve radioimmunoassay. Hydroxyproline, total. This test is performed to detect the percentage of total hydroxyproline. Methods may include high-performance liquid chromatography and colorimetry.